Good morning. Now we are talking about ethics in an instruction course which is mainly about poor man's glaucoma and how to bring down the cost. The reason we need to touch about ethics and talk about it is that ethics and reduction of the cost for treatment of glaucoma are very, very closely linked and interwoven. You cannot separate the two. If you separate ethics, then the cost of treatment of glaucoma is going to phenomenally shoot up. And if you are within your boundary and you adhere to your ethics, the cost of treatment of glaucoma automatically comes down and you don't need to do anything special about it. So this is one of the very important aspects of keeping down the costs in treating glaucoma. In order to give you a brief of what the ethics say about how to conduct ourselves, there are 4 key ethical principles which we need to know. One is the respect for autonomy, second is non-malfeasance, third is beneficence, and fourth is justice. Now, what is respect for autonomy? Most importantly, we have to respect the patient. We have to respect the patient, we have to respect the patient's decisions, what the patient feels about the treatment. We are not the sole people involved in the treatment of the disease. The person having the disease is the patient. So we have to include the patient in all our decision making. We have to take the patients into confidence. We have to keep the pros and cons of drugs and treatment options informed very much to the patient. We have to tell about the side effects of the drugs, the cost, most importantly, the cost of the different medications involved, what are the different options involved. For example, if you are prescribing latanoprost, it is very important that we tell what are the different costing of latanoprost involved and what is the difference, if at all, we perceive between the different brands. Like that, in glaucoma, we are having a lot of generic medicines, and it is one of the important areas where we have to touch upon. The second is non-malfeasance. Doctors have active duty to avoid harm to the patients, of course. We have to keep safety above the profits. We should not see, like for example, if we are going to advise a surgery to a patient, if it is a new device or something which we don't know much about, we have to keep the safety of the patient first and foremost in our mind before we advise it to the patient. Then we are going to bring down the costs quite a lot. We have to follow evidence-based practice, and we have to keep medical knowledge very much updated. Beneficence is the duty to do good. This we have to follow, as all of us being doctors, we should have this as the first and foremost thing in our mind. It is our duty to seek out the most appropriate treatment for the patient, and we have to have regular professional updating. We have to attend CMEs, conferences. We have to update ourselves regarding the different medical options available, what are the new things being introduced, whether the old things are still true. Like for example, we heard about pilocarpine being used. When we have knowledge of all these things, we will be better able to manage a patient and do good to the patient. And lastly, justice. This is more relevant in facilities where free medications are dispersed, like in government hospitals. You might see, if in a government hospital you are good to or very close to one patient, you might end up unintentionally giving more medications to that patient at the cost of not giving medication to another patient. That means you might exhaust the stock of medications, giving a lot of medication stocks to one patient and then harm the other patient. We as doctors should be as just as possible. The distribution has to be equitable and just, and no favor or prejudice should intervene in our decisions. Now the recommendations that I would have is need to prescribe the medicine solely based on the medical needs, the reasonable expectation of effectiveness of the drug or device that needs to be kept in the mind. The prescription should not be based on financial incentives to the treating ophthalmologist. If doctor has financial stake in the company, there may be conflict of interest. So patients have a right to choice and right to information, and inform the patients of different options and give them the choice. It is very essential that we keep ourselves update about the best drug for the condition, not only about the general overall knowledge about glaucoma. We need to know about each and every drug that we have and which is the best medication available and also the most cost effective one. Current preferred practice pattern, we have to update ourselves based on that, and more importantly, update ourselves on the safety information and that keeps getting released every now and then. If you are unsure about the drug or its side effects, we should not hesitate before verifying with an expert in the field. Follow guidelines by local drug regulatory authorities as well. When it comes to patient information, crucial side effects of drugs have to be discussed with the patient. We cannot hide any side effects which may have an important bearing upon the outcome of the medication or the long term of treatment process. The important ones, it is better that we document them. Keep concerned doctors in the loop about medicine when appropriate. For example, if it's a cardiac patient, you have to keep the cardiologist informed when you're starting a beta blocker. And like diabetologist when steroids are started. And you need to have, when you give a prescription, you need to keep a proper prescription to the patient. You need to give a complete prescription. This should be available on the AIOS website. You can probably check it out on that. What are the important things that need to go in a prescription? It should have everything right from letterhead, the doctor's full name, qualifications, date, patient's full name, address, name of the drug, potency, total quantity recommended, and with the rubber stamp and everything. A good prescription should be written legibly. Preferably use electronic means to save and print prescriptions to avoid any confusion, and mention all precautions that the patients need to take. Now coming to the crucial thing about operating our own pharmacy, quite a lot of us, or most of us rather, doctors have our own pharmacy. We should not keep financial considerations when referring to our own pharmacy. It should be primarily for the benefit of the patient. Some hospitals have this facility, or rather, dictum where when they give the prescription automatically goes to their own pharmacy. This is very much unethical. Internet purchasing and sale of the drugs is not ethical and not technical, and it is difficult to control and regulate, and there is lack of pharmacovigilance about this in India. Telephone prescribing can be done, but make sure there is adequate assessment before we prescribe any drug to the patient. Establish a dialogue with the patient, and then try to make sure what the problem of the patient is before we do a telephone prescribing. Obtain patient's consent, ideally record it in his case sheet if you have the case sheet with you, and you should have adequate knowledge about the patient's health when you do it. Some glaucoma specific ethical recommendations: do not prescribe unnecessarily. Incomplete diagnosis is very often the case. Due to inadequate assessment and knowledge, we do this, and anti-glaucoma medications are prescribed on presumption of glaucoma rather than proof of glaucoma quite a lot of times. The side effects, costs of medication, and psychological pain that we cause to the patient have all to be kept in mind when we do this. The cost consideration, especially because glaucoma is a lifelong disease and lifelong treatment which needs to be factored in, and costly medications prescribed influenced by the pharmaceutical companies' pressure should be avoided. We should not do treatment and diagnosis for the sake of follow-up. Quite a lot of times we see in glaucoma, it's pretty common that a patient has been diagnosed to have, or has been asked to come on follow-up, even they don't have glaucoma, just because they want to get the follow-up of the patient and more patients from that patient. This has to be avoided. In order to get a constant flow of patients, we tend to do this, and this is highly unethical and wrong. Glaucoma medication being used as a placebo is very, very wrong. Some medications can be used as glaucomas, but when we, placebos, but again when we do this, the principle of no harm to the patient has to be kept in mind. And treatment on single reading of high intraocular pressure is again a very common thing which happens in glaucoma practice. Quite a few are treated with inadequate diagnosis. Single reading of IOP obviously is inadequate for decision of treatment and the diagnosis of glaucoma. To end, we have to remember this: with great powers there must also come great responsibility. We as doctors, we have great powers in terms of controlling the outcome of a disease, in treating the patient, in making a patient follow the treatment that we want. In fact, we dictate the terms and conditions to the patient. This confers on us great powers. But then we have to exercise this power with lot of restraint and lot of responsibility. Thank you very much. And we have to make a partner in the patient, a partner in the treatment.